This study was conducted in a subtype of sarcoma called leiomyosarcoma, and leiomyosarcomas are one of the more common sarcoma subtypes, probably accounting for about 10 to 15% of all sarcomas. For patients with advanced or metastatic leiomyosarcoma, the treatment options are limited. Systemic therapies can include anthracycline and gemcitabine-based schedules, as well as pazopanib, trabectedin, and dacarbazine, but there's still a huge unmet need for novel, effective, and well-tolerated systemic therapies for these patients. And I think one of the major things that we really need is a better way to identify which patient with leiomyosarcoma is going to benefit from each one of these individual treatments. So this was a randomized phase 3 trial open to patients with advanced or metastatic leiomyosarcoma. Patients had received one or more prior lines of therapy, including an anthracycline-based schedule. They had to have measurable disease by RECIST 1.1 and have a performance status of 0 or 1 and be over the age of 18 years. Patients were randomized to receive either Catequentinib 12 milligram per day, 2 weeks on, 1 week off, or placebo. And that randomization was 2 to 1, so 2 to Catequentinib and 1 to placebo. The primary endpoint of the trial was progression-free survival by blinded independent central radiology review, and secondary endpoints included objective response rate, overall survival, and duration of response. 111 patients were randomized, 75 were randomized to Catequentinib and 36 to placebo. There was a significant difference in progression-free survival between a statistically significant difference in progression-free survival between the two arms. So median progression-free survival for Catequentinib was 3.42 months compared to 1.41 months for placebo, and the hazard ratio was 0.536. One of the major points regarding Catequentinib is that it is very well tolerated with a really good toxicity profile. And because of this, I think one of the major points is that it could potentially be used as a combination therapy for patients with metastatic leiomyosarcoma. I suppose the major thing is, could we do further trials of combination therapy with Catequentinib to try and improve the outcome of patients with metastatic leiomyosarcoma?